Hello ma'am, good morning. I just received your daughter's lab result, and according to this, your daughter has inherited disease called von Willebrand disease.
Ha? Ano yun, Dok? Kailangan mo ba yung operahan?
Von Willebrand disease is an inherited blood disorder in which the blood does not clot properly due to the low levels or abnormal functionality of the von Willebrand factor, which is a protein that mediates platelet adhesion to damaged blood vessels. Normally, when a person is injured and starts to bleed, the von Willebrand factor in the blood attaches to the platelets, which aggregate to form a clot at the site of injury to stop the bleeding. When a person has von Willebrand disease, the clot might take longer to form, causing a longer duration of bleeding. Although rare, the bleeding can be life-threatening. According to the Centers for Disease Control and Prevention, von Willebrand disease is the most common bleeding disorder in the U.S. population. This means that 3.2 million people in the United States have the disease. Women are more likely to notice the symptoms because of heavy or abnormal bleeding during their menstrual periods and after childbirth. In the scenario earlier, our patient is Dana Montes. She is 20 years old female who experienced heavy menstrual bleeding, pale skin, fatigue, weakness, and severe abdominal pain and cramps. Upon consultation, the doctor
In our case, the condition develops complication with blood clotting, which might lead to the bleeding that does not stop quickly. The von Willebrand disease is a hereditary bleeding condition that is caused by an absence or malfunction of the von Willebrand factor, which is a protein that plays a role in the blood clotting process. Von Willebrand factor is responsible for platelets sticking together and transporting factor VIII, also known as antihemophilic factor, which is required for the formation of the clots. In our present case, the patients experience menorrhagia, which is a severe and prolonged monthly flow that can be defined. Platelet tests that evaluate platelet functions, such as platelet aggregation study, which examine the ability of platelets to form clots, or bleeding time tests, which determine the length of time it takes for a tiny puncture wound to stop from bleeding. Both of these type of tests are examples of some of tests that can be conducted in the laboratory. The purpose of the laboratory test for von Willebrand disease is to assist in diagnosing, categorizing, and assessing the condition severity. Platelet tests are administered to patients with menorrhagia to determine if impaired platelet function contributes to the excessive bleeding that is characteristic of menorrhagia. The bleeding time test involve making a tiny puncture wound or incision and observing how long it takes for the wound to cease bleeding. However, it is essential to remember that the bleeding time test is not commonly utilized in clinical practice today, and that its value in evaluating menorrhagia is limited. In our case, the condition identified as menorrhagia that is characterized by abnormally heavy and extended menstrual flow. The bleeding time test may provide some insight into an individual's general bleeding tendency, including any platelet-related bleeding disorder that may be present. However, it should be emphasized that menorrhagia is often caused by causes other than platelet failure, such as hormonal imbalance or structural abnormalities, and the bleeding time test may not pinpoint the underlying causes.
A normal examination involves evaluating a lady, her heavy menstrual periods which she has experienced since her early 20s are noteworthy in her medical history. Her periods are extremely heavy and last between 7 and 10 days. Additionally, she suffers from epistaxis around once a month, which once required packing. She has undergone multiple menorrhagia examinations with her gynecologist, but no clear gynecologist cause of her disease has been identified. There have been heavy periods for her mother and one of her three sisters as well. Physical examination, including vital signs, is normal. Laboratory studies include a proton beam time of 12 seconds and an activated partial thromboplastin time of 39 seconds. The complete blood count indicates a hemoglobin of 10.3 grams per dl, leukocyte count of 5,400 per UL mean, corpuscular volume of 72 fluid, and a platelet count of 500,000 per UL.
Desmopressin. This medication is available as an injection. This is a synthetic hormone that controls breathing by stimulating your body to release more and the von Willebrand factor stored in the lining of your blood vessels. Next is replacement therapies. These include infusion of concentrated blood clotting factors containing von Willebrand factor and factor VIII. Next is oral contraceptives. In addition to preventing pregnancy, these drugs can help control heavy bleeding during menstruational period.
A test was done to determine whether the patient has chronic kidney disease because of the same symptoms the patient was presenting. A blood test was done in order to see the levels of creatinine in the blood of the patient, which was normal. A urine test was also performed to check the presence of blood and protein, as well as the albumin and creatinine ratio, which all checks out and appears to be normal or no significance. This rules out the chronic kidney disease on the patient.
One of the symptoms of von Willebrand's disease is heavy and longer menstrual bleeding called menorrhagia. These symptoms can be also associated with other kind of disease such as uterine-related problems like uterine polyps. The difference with this disorder to von Willebrand's disease is uterine polyps, also known as endometrial polyps, form as a result of cells in the lining of the uterus overgrowing. These polyps are usually non-cancerous, although some can be cancerous or can turn into cancer. Whereas von Willebrand's disease is a lifelong bleeding disorder in which your blood doesn't clot properly. People with the disease have low levels of von Willebrand's factor, a protein that helps blood clot, or the protein doesn't perform as it should. If the patient undergoes transvaginal ultrasound and the result is normal or no polyps found in the uterine, the patient doesn't have a uterine polyps. And if the patient blood test results such as factor 7 clotting activity, von Willebrand's factor antigen, histiocytin cofactor, or other VWF activity, von Willebrand's factor multimers, and platelet aggregation test shows an abnormal result, the patient can now be diagnosed of having von Willebrand's disease.
Von Willebrand's disease is a common cause of heavy menstrual bleeding and other bleeding problems in women and adolescent girls.
This disease is inherited, which is why it is crucial for us to get tested or screened at an early age to receive the right treatment for our condition.
Since several conditions can be associated with heavy menstrual bleeding, it is important that we, as a patient, consult a doctor to rule out other disorders that are not the actual cause of what we are experiencing.
There are several ways that VWD can be detected.
As a medical technologist, it is crucial that we remember all of them in order to perform the ideal test to produce accurate results.
Always remember that good diagnosis leads to the best opportunity for a positive health outcome.